Have you ever had a day when your body felt slightly off? Not enough to worry you, but just enough to make you pause and wonder if something had changed. One of my patients once shared with me that the most serious illness she ever faced did not begin with pain or panic, but with a quiet tiredness she brushed aside for weeks. I want you to imagine this for a moment. A signal so gentle that it blends into everyday life, especially after 60, when we are used to listening through layers of routine, memory, and responsibility. My name is Dr. Evelyn Carter, and I have spent decades caring for older adults and walking alongside families as they learn to trust their bodies again. Today, I want to talk with you calmly and honestly about Nipah virus early warning signs, not to frighten you, but to help you listen with more confidence. Nipah virus is rare, and I want to be very clear about that. Learning about early signs is not about expecting danger. It is about calm awareness and self-respect. In my experience, many serious conditions in later life begin quietly. They do not announce themselves with drama. Seniors often dismiss early symptoms because they feel like fatigue, a mild flu, or simply another sign of aging. Doctors can miss early warning signs too, not because they are careless, but because early symptoms are subtle, non-specific, and often hidden behind chronic conditions the body already carries. As we age, our bodies speak a softer language. Signals may come more slowly, appear less intense, or show up in unexpected ways, including changes in energy, focus, or sleep. This video is not here to diagnose you. It is here to guide you in listening, with patience and dignity, so you can protect your emotional safety and your independence. In the next part, we will gently explore why early warning signs are so easy to overlook, and how aging changes the way illness begins. Later, we will talk about what calm action looks like, and how knowledge can reduce fear and restore a sense of control. If this feels helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. This channel exists to support you, quietly and steadily, as you continue aging with clarity, confidence, and care. Why early symptoms are often overlooked. As we grow older, our bodies become wise storytellers, but they also learn to speak more quietly. I have seen this again and again in my years of caring for older adults. Symptoms that once would have demanded attention in our 40s can feel muted in our 60s and 70s. A low fever may barely register. Fatigue may feel like an ordinary afternoon. A mild headache may blend into the background of a long life already lived with aches and responsibilities. This is one of the main reasons early symptoms are so often overlooked. Early viral symptoms frequently resemble conditions that are already familiar to seniors. Tiredness can look like a poor night of sleep. Body aches can resemble arthritis. A slight change in appetite may seem like stress or routine disruption. Because these sensations feel ordinary, many older adults respond with patience rather than concern. That patience is often a strength, but it can also cause important signals to be quietly set aside. There is also a dignity in how seniors carry discomfort. Many people I care for do not want to burden their families or rush to the doctor for something that might pass. They tell themselves they will wait another day or two. Sometimes they wait a week. Often they are right and the body settles. Sometimes the body is asking to be heard more closely. Doctors face a challenge as well. When an older patient comes in feeling unwell, the most responsible step is often to rule out common causes first. Dehydration, medication side effects, seasonal illness, or chronic conditions are far more likely explanations than a rare infection. This careful approach protects patients from unnecessary testing and anxiety, but it can also mean that subtle early signs take time to reveal their true meaning. Another layer is how aging affects the immune response. With age, the immune system can react more slowly and less dramatically. Instead of a sharp fever or intense pain, the body may show quieter signs like confusion, sleepiness, or a general sense of being off. These changes are easy to miss, especially when life already includes memory lapses or fluctuating energy. Understanding why early symptoms are overlooked is not about blame. It is about compassion for the aging body and respect for the thoughtful caution of both patients and doctors. When we recognize this pattern, we can begin listening more carefully, with patience and curiosity rather than fear. That calm attention is one of the most powerful tools we have to protect health, dignity, and peace of mind as we age. How Nipah virus begins in the body. When I explain how an illness begins, I like to start with something familiar. Think about the way your home responds to a change in weather. Before you see rain, you might feel the air shift. The light looks different. The temperature changes by just a few degrees. Your body works in a similar way. Long before symptoms become clear, your immune system notices that something is different, and it begins to respond. With a virus like Nipah, the first steps happen quietly. A virus cannot live on its own. It has to enter the body and use the body's cells to make more copies of itself. When that happens, your immune system starts scanning for anything that does not belong. In the earliest stage, it is not always certain what it is dealing with. It only knows that something is off, and it turns on the first layer of protection. That first layer is what creates the early symptoms that feel so general. You might feel tired, not because you did anything wrong, but because your body is redirecting energy. When the immune system activates, it uses fuel. It also sends out signals that can raise your temperature slightly, change your appetite, and make your muscles ache. These are not specific to Nipah. They are the body's standard language for early defense. In my clinic, I often tell patients that early symptoms are like a smoke alarm. It tells you something needs attention, but it does not tell you whether the source is toast in the kitchen or a wiring problem in the wall. This is why early symptoms can look like the flu, a cold, or even simple exhaustion. In older adults, this effect is even stronger because the body is already managing other ongoing needs. If you live with arthritis, diabetes, heart disease, or sleep problems, your baseline can already include fatigue or aches. That makes it harder to notice the beginning of something new. There is also a reason doctors cannot always name a virus in the first days. Early on, many infections trigger the same early immune response. The body does not label symptoms with a neat tag that says what caused them. It offers clues over time. As the immune system continues to fight, the pattern becomes clearer. That pattern is what we listen for. How long does the fever last? Does the fatigue deepen? Does confusion appear? Are there changes in breathing, balance, or alertness that are not typical for you? I want you to hear this in a reassuring way. The fact that early symptoms are general does not mean you are helpless. It means you need a calm approach. Notice what is new for you. Pay attention to changes that persist or changes that come in clusters. If you are caring for someone with memory loss, this matters even more because the earliest sign may be a shift in attention or behavior before anyone mentions feeling sick. When you understand how a virus begins, you stop expecting your body to give you a dramatic warning. You begin to respect the quieter messages. And for many older adults, that is where true protection starts. Early physical signals that feel ordinary. Some of the earliest physical signals of illness are the easiest to dismiss, especially later in life. I have sat with many older patients who told me they almost did not come in because nothing felt serious enough to mention. They felt a little warmer than usual, but not truly feverish. They felt more tired, but assumed it was a poor night of sleep. They noticed a dull headache that came and went, and they told themselves it was dehydration or stress. A mild fever in an older adult does not always look the way people expect. Younger bodies often respond with a clear spike in temperature. Aging bodies may only rise slightly, sometimes not enough to trigger concern. Fatigue is even more complicated. After 60, many people already pace their energy carefully. They know some days are slower than others. When fatigue shows up early in an illness, it blends easily into normal variation. Headaches can feel familiar too, especially for those who have lived with sinus issues, vision strain, or blood pressure changes. These signals are often dismissed because they are not new sensations, only slightly different versions of familiar ones. Seniors are thoughtful observers of their bodies. but they are also patient and resilient. Many prefer to wait and see if a symptom settles on its own. That instinct is not wrong. In fact, it reflects a lifetime of learning how the body heals. The challenge is knowing when something ordinary is lasting longer than it should. I remember a woman in her early 70s who told me she felt tired for several days and had a faint headache she could not quite describe. She kept her routine, cooked her meals, and took short walks. She said she did not want to overreact. When her daughter noticed she was napping more and missing parts of conversations, they decided together to come in. Nothing dramatic had happened. It was the accumulation of small changes that mattered. In caregiving, we often talk about patterns rather than moments. A single afternoon of fatigue is rarely meaningful. Fatigue that deepens over several days deserves attention. A headache that returns each morning may be different from one that fades quickly. A low fever that lingers quietly can be more important than a high fever that resolves in a day. These are the nuances that get lost when we expect illness to announce itself loudly. For those caring for someone with memory concerns or early dementia, early physical signals may show up as changes in routine rather than complaints. A missed meal, less interest in conversation, more time spent resting. These are physical messages expressed through behavior. I share this not to make you watch your body with worry, but to encourage respectful listening. Your body does not shout first. It whispers. When you allow yourself to notice those whispers with patience and without judgment, you protect your health while honoring the dignity of your lived experience. Subtle, cognitive, and emotional changes. Some of the most important early changes do not show up in the body first. They appear in the mind and in emotions, and they are often misunderstood. I have learned over the years that confusion, unusual sleepiness, or irritability can be some of the quietest signals that something in the body needs attention. These changes are easy to overlook because they feel personal rather than physical. A little confusion can look like misplacing words, losing track of time, or feeling slightly disoriented in familiar routines. Unusual sleepiness may show up as longer naps or difficulty staying alert during conversations. Irritability can appear as impatience, withdrawal, or emotional sensitivity that feels out of character. Many older adults tell me they assume these changes are simply part of aging or stress. Some worry it might mean dementia is suddenly worsening, and they feel embarrassed or frightened to say anything at all. This is where calm understanding matters. The brain is deeply connected to the immune system. When the body is under stress from infection or inflammation, the brain often feels it early. In seniors, this connection can be even stronger. Aging brains may react to physical changes with shifts in attention, mood, or energy before clear physical symptoms appear. This does not mean the brain is failing. It means the brain is responding. In people who already live with mild cognitive impairment or dementia, these changes can be even more subtle. A person may become quieter than usual or more restless. They may sleep at unusual hours or seem emotionally distant. Caregivers often tell me they thought it was a bad day or a normal fluctuation. Sometimes it is. Other times, it is the body asking for support in its own way. Emotional changes matter because they affect safety, routine, and dignity. When someone feels confused or unusually sleepy, they may skip meals, miss medications, or withdraw from activities that support their well-being. Irritability can strain relationships and make caregiving feel harder than it needs to be. When these changes are noticed early, small adjustments can protect both physical and emotional health. I often remind families that behavior is communication. Especially in older adults, the body and brain speak through mood and routine as much as through pain or fever. Paying attention to these signals does not require fear. It requires curiosity and kindness. Ask gentle questions. Notice what is different, not what is wrong. When we honor cognitive and emotional changes as meaningful signals rather than personal failures, we create space for calm action. We protect the brain, reduce distress, and preserve dignity. This kind of awareness supports not only health, but also trust between the body, the mind, and the people who care. Symptoms. Doctors may miss at first. I want to speak honestly about something that many patients feel, but rarely say out loud. Sometimes symptoms are missed not because anyone is careless, but because medicine itself must move carefully, especially with older adults. I have been on both sides of that conversation, sitting with patients who feel something is not right, and weighing what is most responsible to do in a limited amount of time. Most medical appointments are short. In those minutes, a doctor has to listen, review medications, consider long-standing conditions, and decide what is most likely and most urgent. When symptoms are mild or unclear, the safest choice is often to look first at the most common explanations. Fatigue may be related to sleep, mood, or heart health. Confusion may be linked to medications, dehydration, or blood sugar. Headaches may come from vision strain or blood pressure. These possibilities are far more common than rare infections, and ruling them out protects patients from unnecessary tests and worry. Chronic conditions add another layer. Many seniors live with arthritis, diabetes, heart disease, lung conditions, or memory changes. These conditions already shape how the body feels day to day. When something new begins quietly, it can hide within what already exists. A change in energy might be blamed on heart health. A change in thinking might be attributed to aging or early dementia. Even experienced doctors must take time to notice when a familiar pattern begins to shift. This is where watchful waiting comes in. It is not neglect. It is a thoughtful pause. Watchful waiting means observing how symptoms evolve over time. Do they improve with rest and hydration? Do they remain stable? Do they slowly progress? In many cases, the body settles and no further action is needed. In other cases, the pattern becomes clearer, allowing for better decisions and safer care. From my experience, what helps most is partnership. When patients or caregivers return with careful observations, it gives doctors valuable information. Saying something like "this feels different from my usual fatigue," or "this confusion is new for me," helps guide attention. Patterns matter more than single moments. Changes over days matter more than how someone feels in one afternoon. I also want to reassure you that missed early symptoms do not mean failure. They reflect the complexity of caring for aging bodies with respect and caution. Medicine is not about instant answers. It is about listening over time. When seniors feel empowered to notice changes and share them calmly, and when doctors are given the space to observe thoughtfully, care becomes safer and more humane. This shared patience protects dignity and builds trust, which is just as important as any test or diagnosis. Staying connected and supported. One of the quiet truths I have learned through decades of caring for older adults is that health does not exist in isolation. It grows stronger when people feel seen, heard, and supported. Many seniors tell me that what helps them most is knowing they are not facing changes alone. Even understanding a condition together, listening to the same explanation, or sharing a moment of recognition can bring calm to the body and steadiness to the mind. When we talk about health, especially later in life, community matters. Information feels different when it arrives with warmth rather than urgency. It settles better when it is shared rather than delivered. That is why spaces like this exist. Not to overwhelm you with facts, but to walk alongside you as you learn how your body communicates and how your routines can protect your well-being. I often think of the caregivers who watch these videos quietly in the evening, after a long day of helping someone they love. I think of older adults who sit with a cup of tea, listening carefully, hoping to understand themselves a little better. Staying connected gives those moments meaning. It reminds us that caring for health is not about reacting to fear. It is about building understanding over time. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. That simple act of staying connected helps this community reach others who may need reassurance just as much as you do. Sharing information is a form of care. It allows calm guidance to travel from one living room to another, from one family to the next. It helps normalize questions that many people are afraid to ask out loud. Staying informed together also protects emotional safety. When you hear information presented gently and consistently, your nervous system stays calmer. You feel more capable of noticing changes without panic. You learn to trust patterns rather than isolated moments. This is especially important for seniors and for those caring for someone with memory changes. Routine and familiarity create a sense of safety that supports both physical and cognitive health. Senior Health Daily is not about chasing every new worry. It is about returning to steady ground. It is a place where learning happens at a human pace, where dignity is honored, and where patience is treated as a strength. As we continue, I want you to remember that staying connected is not a commitment you owe anyone. It is a choice you make for your own clarity and peace of mind. Differences in older adults. As we move through our 60s and beyond, our bodies continue to protect us, but they do so in quieter and more measured ways. One of the most important differences I have seen in older adults is how the immune system responds to change. The immune response often becomes slower. It does not rush forward with dramatic signals. Instead, it works steadily in the background, sometimes taking longer to show clear signs that something is happening. This slower response means that fever, one of the signals people expect most, may not appear in a strong or obvious way. Many seniors never develop a high temperature, even when the body is working hard to fight infection. The thermometer may show only a small rise, or none at all. Yet inside, the immune system is still engaged. Because fever is often used as a marker for illness, its absence can create a false sense of reassurance. I have cared for many older patients who were surprised to learn they were ill because they never felt truly feverish. Instead, they felt weak, foggy, or unusually tired. Some noticed changes in balance or appetite. Others felt emotionally flat or more anxious without understanding why. These are not signs of failure. They are signs of a body responding in a way that reflects years of adaptation. Another important difference is the risk of complications. When the immune system reacts more slowly, it can take longer to clear an infection. During that time, stress on the body can affect other systems. Breathing may feel more effortful. Heart conditions may feel less stable. Memory and attention may fluctuate. For those living with dementia, illness can temporarily worsen confusion or agitation, even if physical symptoms seem mild. This is why noticing early changes matters so much in older adults. It is not about expecting the worst. It is about giving the body support sooner, before small challenges become larger ones. Early attention allows for rest, hydration, monitoring, and communication with healthcare providers in a calm and thoughtful way. I often tell families that aging does not mean becoming fragile. It means becoming different. The body has learned efficiency, it conserves energy, it adapts. When we understand these differences, we stop waiting for dramatic warning signs and start respecting the quieter signals. By honoring how aging bodies respond, we protect dignity and independence. We reduce unnecessary fear and replace it with informed care. This understanding allows seniors and caregivers alike to move forward with patience, confidence, and a deeper trust in the wisdom of the body. When to pause and pay attention. One of the most helpful lessons I share with older adults and families is this: the body rarely tells its story in a single moment. It speaks in patterns. What matters most is not how you feel in 1 hour, but how things change over several days. This is where calm attention becomes a form of care. A single afternoon of fatigue is usually just that: a poor night of sleep or a busy morning. But when fatigue deepens day after day, when naps become longer, or routines begin to slip, the body may be asking for a pause. The same is true for appetite, focus, balance, and mood. A skipped meal once is rarely important. A steady loss of interest in food over several days deserves a closer look. Trusting intuition does not mean expecting danger. It means respecting familiarity. You know your own rhythms. You know what feels normal for you. When something feels different in a way that does not settle, it is reasonable to pay attention. That inner sense is not fear, it is experience. Over a lifetime, you have learned how your body usually responds to stress, illness, and rest. That knowledge is valuable. I often remind patients that intuition becomes clearer when the mind is calm. Anxiety makes everything feel urgent. Calm awareness allows you to notice gently. Write things down if that helps. What changed? When did it start? What stayed the same? Patterns reveal themselves when we slow down enough to observe. Caregivers and family members play a special role here. Those who spend time with an older adult often notice changes before the person does. A different tone of voice, less interest in conversation, a pause before answering a familiar question. These are not reasons to panic. They are invitations to check in with kindness. Asking how someone feels, offering rest, or suggesting a simple check with a doctor can be done without pressure. For those caring for someone with memory loss, patterns are especially important. Illness may show up as restlessness, withdrawal, or confusion rather than complaints of pain. A person may not be able to explain what feels wrong. In these moments, caregivers become the voice of observation. Noticing changes over time helps protect safety and dignity. Pausing does not mean stopping life. It means giving space for understanding. It allows you to respond thoughtfully instead of reactively. When seniors and families learn to watch patterns rather than chase single symptoms, healthcare becomes steadier and less frightening. This kind of attention supports emotional safety. It keeps routines intact while allowing flexibility. It honors patience as a strength. Most of all, it reminds us that listening carefully to the body is one of the most respectful forms of care we can offer ourselves and those we love. What calm action looks like. Calm action begins long before any urgent decision is needed. It starts with clarity, and clarity grows when we slow down just enough to notice and remember. One of the most helpful things an older adult or caregiver can do is to gently document changes. This does not need to feel clinical or overwhelming. It can be as simple as noting when fatigue began, how sleep has changed, or whether appetite feels different than usual. Writing things down protects the mind from worry, because you no longer have to hold everything at once. When symptoms are written or remembered as a pattern, conversations with doctors become clearer and more productive. Instead of trying to describe everything in a rush, you can share what has changed over time. Saying something like "this tiredness is new for me," or "this confusion is different from my usual memory lapses," helps guide attention. Doctors listen closely when patients speak in this way, because it reflects awareness rather than alarm. Clear communication also means sharing context. What medications are being taken? What routines have shifted? Whether there has been recent stress, travel, or disruption to sleep. These details help doctors understand the full picture of an aging body. Medicine works best as a partnership. When information flows calmly in both directions, decisions become safer and more thoughtful. Avoiding panic-driven decisions is especially important for seniors. Panic narrows attention and can lead to unnecessary tests, rushed choices, or emotional exhaustion. I have seen many families frightened by a single symptom that resolved with rest and hydration. I have also seen how anxiety itself can worsen confusion, blood pressure, and sleep. Calm does not mean ignoring concerns. It means responding in a way that protects both the body and the nervous system. Calm action often looks quiet. It may mean resting an extra day, drinking more fluids, checking in with a trusted doctor rather than rushing to conclusions. It may mean asking for help from a family member or caregiver so that decisions are not made alone. For those living with dementia, calm action includes preserving routine as much as possible. Familiar schedules and surroundings reduce stress and support the brain during times of physical strain. I often tell patients that the goal is not to control every outcome. The goal is to stay grounded while information unfolds. When you act calmly, you give your body the best chance to show what it needs. You also give yourself permission to move at a human pace, rather than the pace of fear. Calm action honors dignity. It respects the wisdom of experience. It allows seniors and caregivers to remain steady, even in uncertainty. And in that steadiness, good decisions become more visible and more kind. Protecting emotional safety. Emotional safety is not something separate from physical health. It is deeply woven into how the body heals, how the brain functions, and how we cope with uncertainty as we age. I have seen many times that anxiety itself can become heavier than the illness someone is worried about. When fear takes over, sleep suffers, appetite fades, blood pressure rises, and thinking becomes less clear. The body feels under attack, even when it is only asking for rest and attention. This is why protecting emotional safety matters so much for older adults. The nervous system changes with age. It can become more sensitive to stress and slower to recover from it. When worry stays high, the body remains tense, and healing becomes harder. Calm observation, on the other hand, tells the nervous system that it is safe to slow down. When the mind settles, the body can focus on repair rather than defense. I often encourage patients to notice how their thoughts shape their physical experience. When symptoms are met with panic, every sensation feels louder and more threatening. When symptoms are met with curiosity and patience, they become easier to understand. Calm observation does not deny what is happening. It creates space around it. That space allows better sleep, steadier breathing, and clearer thinking. These are not small things. They directly support immune function and brain health. For seniors living with memory changes or dementia, emotional safety is especially important. Confusion can worsen quickly when fear enters the room. A calm voice, familiar routine, and gentle reassurance can make a meaningful difference. Even when physical symptoms are mild, emotional distress can create agitation or withdrawal that affects daily life. Protecting emotional safety helps preserve dignity and connection during vulnerable moments. I want to reframe how we think about health. Health is not a battle to be won or lost. It is a partnership between you, your body, your caregivers, and your doctors. Partnerships require listening, trust, and patience. When we treat the body as an enemy, we miss its wisdom. When we treat it as a partner, we learn how to support it more wisely. In my years of practice, I have seen that the most resilient seniors are not those who never face illness, but those who face it with steadiness. They allow information to unfold. They ask questions without fear. They rest when rest is needed. They accept help without shame. Protecting emotional safety allows you to move through uncertainty without losing yourself to it. It reminds you that you are not defined by a symptom or a diagnosis. You are defined by a lifetime of strength, adaptation, and care. And when you approach health in this way, with calm and partnership, you give yourself the greatest gift possible as you continue aging with dignity. As we come to the end of our time together, I want to slow everything down for a moment. There is nothing more you need to remember right now. Nothing you need to decide. Learning about health, especially at this stage of life, does not mean danger is close. It means you chose understanding instead of uncertainty, and that choice alone deserves respect. Over the decades, your body has carried you through change, loss, joy, illness, and healing. It has adapted in ways you may not even notice anymore. Every quiet morning, you woke up and continued. Every time you rested when rest was needed. That resilience matters. It is easy to forget how much strength lives in an aging body when the world focuses only on decline. I want to remind you that your body is still working with you, not against you. Awareness is not fear. Awareness is an act of self-respect. When you listen gently to your body, you honor the life it has lived and the life it continues to support. Patience is not weakness, it is protection. Calm is not avoidance, it is wisdom. Dignity grows when we allow ourselves to move at a human pace, rather than rushing to conclusions or borrowing worry that does not belong to us. If there is one feeling I hope you carry with you after this video, it is reassurance. You do not need to be perfect to care for your health. You only need to be present, curious, and kind to yourself. That is enough. Senior Health Daily exists for moments like this, a steady place you can return to when questions arise, when nights feel long, or when you simply want to feel understood. There is no urgency here, only continuity. Thank you for staying with me today. If it feels right, I invite you to stay connected with Senior Health Daily. We will be here, quietly walking alongside you, as you continue aging with patience, confidence, and grace.